Hello, my name is Leslie Chow, and I will be presenting an educational module on the utilization of Amisulpride as part of the multimodal treatment modality for postoperative nausea and vomiting prophylaxis in adult surgical patients. The learning objectives for this module is understanding the prevalence of postoperative nausea and vomiting, identifying risk factors that contribute to postoperative nausea and vomiting, demonstrating knowledge of the potential complications associated with postoperative nausea and vomiting, discussing the mechanism of action of Amisulpride, and identifying the advantages of utilizing Amisulpride as a pharmacological complement for PONV. Background. Postoperative nausea and vomiting is defined as nausea and/or vomiting that occurs in the immediate 24 postoperative hours. Postoperative nausea and vomiting is the second most common complaint after a surgical procedure. Various patient, surgical, and anesthetic factors can be identified as reliable predictors of the occurrence and severity of postoperative nausea and vomiting. As you can see in this figure, each size of the segment is proportional to the odds ratio of postoperative nausea and vomiting associated with each risk factor. Scope of the problem. In high-risk surgical procedures and high-risk patient groups, the risk of postoperative nausea and vomiting has been shown to be as high as 80%. Potential complications associated with postoperative nausea and vomiting include airway compromise, delayed recovery, aspiration, dehydration, electrolyte imbalances, wound adhesions, bleeding, venous hypertension, increased cost of care, and in addition, unplanned readmission. Patient-specific risk factors include female gender, age less than 50 years old, age greater than 3 years old, non-smoking status, history of motion sickness, and a previous history of postoperative nausea and vomiting. Surgical risk factors. Surgical risk factors for postoperative nausea and vomiting include longer procedure times, generally greater than 1 hour, breast procedures, laparoscopic procedures, intra-abdominal procedures, ophthalmic procedures, and otorhinolaryngological procedures. Anesthetic risk factors for postoperative nausea and vomiting include opioid administration, longer exposure time to anesthetics, general anesthesia technique, inhalational anesthetics, and nitrous oxide. Current practice. The current guidelines for the management of postoperative nausea and vomiting recommends a combination approach utilizing at least 2 interventions from different drug classes. Utilizing a multimodal approach ensures that multiple receptors are antagonized, diminishing the chances of inadequate prophylaxis treatment. Here's a table provided by the International Anesthesia Research Society summarizing common combinations of antiemetics recommended for postoperative nausea and vomiting prophylactic combination therapy for adults and children. This is the International Anesthesia Research Society 2020 Adult Postoperative Nausea and Vomiting Guidelines. It provides you with a diagram of risk factors, risk mitigations, risk stratifications, prophylaxis, and rescue treatment for adult PONV management. Amisulpride. Amisulpride is a selective antagonist for dopamine 2 and dopamine 3 receptors. It was approved by the FDA in 2020 for both treatment and prevention of post-op nausea and vomiting. The recommended dose is 5 milligrams infused over 1 to 2 minutes and induction of anesthesia for post-op nausea and vomiting prophylaxis. Administration of Amisulpride has shown to increase serum prolactin levels. However, it has a high safety profile overall. No extrapyramidal symptoms, sedation, or QT prolongation was noted in any of the studies. It has a low propensity for drug interactions, neither an inducer nor inhibitor of cytochrome P450, and can be safely used in elderly and patients with renal failure. Amisulpride. Administration of Amisulpride has shown to decrease the incidence of nausea by 27% in high-risk patients. Administration of Amisulpride has also shown to decrease the incidence of vomiting by 21% in high-risk patients. When combined with other antiemetics, the incidence of postoperative nausea and vomiting is decreased by 20 to 25%. Up to 57.7% of patients demonstrated no sign of postoperative nausea and vomiting in the 24-hour postoperative period. Reduced incidence of postoperative nausea and vomiting in 24 hours in patients with 2 or more risk factors by 10% when given in combination with other antiemetics. A 5 mg dose of Amisulpride demonstrated a reduced postoperative nausea and vomiting from 69 to 40%. Aprepitant, a neurokinin 1 receptor antagonist, given as an oral dose of 40 mg, 80 mg, or 125 mg prior to induction of anesthesia, shown to be only superior in the prevention of postoperative vomiting when compared to ondansetron. When used in combination of other antiemetics, it can decrease the incidence of postoperative nausea and vomiting by 19%. Up to 45% of patients demonstrated no signs of postoperative nausea and vomiting in the 24-hour postoperative period when given aprepitant preoperatively. Aprepitant is a dose-dependent inhibitor and inducer of the cytochrome P450 and CYP3A4 family of enzymes. It can potentially delay recovery from fentanyl or midazolam. It can also induce CYP2C9. Take-home points. Despite improvement in anesthesia care and the development of various guidelines and multiple prevention strategies, postoperative nausea and vomiting rates remain high. A multimodal approach utilizing a combination of medications from various drug classes with different mechanisms of actions can be administered for optimal efficacy in preventing and treating patients for postoperative nausea and vomiting. Recent studies demonstrate a decreased incidence of postoperative nausea and vomiting when Amisulpride is utilized in combination with other antiemetics in addition to when Amisulpride is used as a sole agent. Amisulpride demonstrated efficacy for postoperative nausea and vomiting prophylaxis and did not exhibit any significant adverse reactions, interactions with other medications, extrapyramidal symptoms, or increased sedation level.